Welcome to the Functional Nurse Podcast, where we explore how nurses are transforming healthcare through functional medicine and nurse-led innovation. I'm your host, Bridget Sager, founder of the Institute for Functional Nursing. Here, we're reclaiming our role as healers and leaders, one root cause conversation at a time. Hello, and welcome to this episode of the Functional Nurse Podcast. Today, we're going to be talking about a topic that I have talked to my students about many times and unfortunately have encountered with my own patients, with my family, with my students having that occurred to themselves and their family and their own patients as well. It's something that I think is really unfortunate that is occurring in the integrative space that I think we haven't talked about on the podcast enough already. And so I thought we would have an episode about it. It's a bit timely now because what I'm going to share is I have a personal story for you and I have permission to share the story, but it's been something that's kind of been going on for years that I think a lot of my listeners can relate to. So, what I want to share with you is the idea of there being so many practices that are claiming to practice functional medicine that are not. Not only are they not truly doing root cause care and helping patients find true healing, they're charging incredible amounts of money for these services. And I feel like it's a bit of a false promise that they're giving. It's false advertising. It's giving functional medicine a bad name, unfortunately. It just really isn't helping heal people. But it often can also make it hard for people to seek functional medicine in the future because they've been burned, or it kind of lumps us in with people that are pretending to practice functional medicine and they're not. And I have been experiencing this myself and hearing these stories from my students and patients for years now. I have a family member that I'm going to share their story, and I think a lot of you can relate to kind of how this unfolded. Originally, I think like a lot of us, we are learning functional nursing, functional medicine, and we start maybe working on our own health more. We're seeing great results. We're applying it with our patients and they're getting great results. And so we want it for everybody in our life. And not everybody is ready for this. And not everybody is ready to make drastic changes to their health behaviors or do the deep digging and work that's required sometimes for functional medicine. And that can be really challenging, particularly I think for nurses because of our spirit and, what we hope for our patients and our loved ones. But it's a reality that not everybody is going to be ready for this. In the years that I've taught functional medicine and had many, many meetings with my students and had these discussions, we've talked about the ideas of, wanting this for people who aren't ready yet. I think it's a big theme for us as a profession, and particularly in this niche of healthcare. I have shared stories of my own experience with wanting it for people in my life that weren't ready yet. One that I think I'm really easy for me to talk about, and I know I have permission, is like, when you have young sons, my sons, when they were tweens in particular, you don't have a lot of control over what they're eating. And so a lot of my students have been able to relate to that, trying to make healthy changes at home and having resistant teenagers or children in general, partners. But I think a lot of the time as nurses, family members will come to us for health advice. And it's a hard line to walk between giving advice and being their provider and being their family member. And in particular, when I became a nurse practitioner, I felt like I really had to draw a line there because I started to notice that when people ask you for health advice, they don't always tell you the whole story. And so you're not really getting the picture that you would get if, for example, as a nurse practitioner, if my patient comes into my office, they go through a check-in process, they update their medication list, we find out what they've been up to since the last visit. It's a formal conversation where I get to ask a bunch more questions to get information before I make a diagnosis and we talk about a plan. As I was training to be a nurse practitioner and kind of identifying that, I was realizing that there are a lot of opportunities to cause harm when we give patients advice without getting the full story. And in my own life, I have absolutely experienced that. Someone will ask for advice and later, or if you ask the right questions, you find out, oh, well, I don't even take that anymore. My cardiologist stopped that last month or what have you, right? And you're like gobsmacked because you should have been told, you feel like they should have known to tell you that, but they don't because they're not a provider and they don't understand the process that we go through to deliver safe care. And so we can't really do that in the same way with our loved ones that we can with our patients in like a patient provider partnership. So, that being said, when I have students asking me, well, how do you handle this? We talk about using like the IFM patient search feature so they can search for a provider that is taking patients that are like maybe a certain theme, like they're looking for somebody that specializes in cardiometabolic health, gut health, hormone health. So they can use filters to find out, is it a provider that accepts insurance? Do they see patients in my area? Do they do virtual or in-person visits? And that's always been my answer is that if you feel like your person that's asking you for advice is maybe too personal for you, they're either a friend or a loved one, or you don't feel like what they're looking for help with is in your wheelhouse. I think that is often like the best answer is to just say, I think that you could benefit from talking to a functional medicine provider and let's find a reputable one. And just as many times I have had people come to me as patients, or my students have told me these stories over and over again that patients come to them having seen a quote unquote functional medicine provider already, and they have spent thousands of dollars. They come in with armloads of supplements. They never got any real health advice. There was no root cause work going on. Often they did nothing about diet or lifestyle or exposures or any of the things that we tend to do to address the root cause for people. And so essentially, it was that concept that I've talked about a lot in the past where like functional medicine has this reputation for being really expensive tests and really expensive supplements. That example of like people just showing up with a bunch of supplements and they're still just refilling them. They have no idea what they're for. That to me is just like a huge red flag. Like very unlikely that person was practicing true root cause medicine, especially when then I'll take a look at like the test results and see opportunities to help the person that are not about long-term supplements, but truly about addressing the root cause. And maybe the person that ordered all these really expensive tests wasn't even fully qualified to use them. And they didn't get proper training to actually practice root cause medicine. And so instead, they were just maybe being taught by a supplement company how to like use the supplements based on test results. I'm just assuming here because I don't know, because that seems to be what I've encountered. That's what my students have encountered quite a bit. In my community, I've mentioned people often ask me who they can see around here that practices functional medicine. And ironically, because I live in sort of a functional medicine like birthplace almost. Washington State is kind of where most of the most respected functional medicine folks started. IFM is here. Dr. Bland and Deanna Minnick aren't far from me, but there aren't a lot of providers within driving distance of our community for patients to see. And so there is somebody in my community that says they practice functional medicine, and I have inherited their patients, and they are always on a ton of supplements. They have a ton of testing done, and they're still struggling. They have not worked on diet. They have not worked on all these things. And so I have definitely encountered that quite a bit. And I think it's unfortunate that for a lot of our patients, in our communities, there isn't somebody practicing true root cause approaches to care. So patients that are trying out functional medicine and hoping for the type of care that we offer aren't getting it there. They're getting something that makes us look bad by having the same type of name. And so I'm not claiming to have a solution to this, but I thought we should talk about it more. So I wanted to tell you a little bit more about this story because I feel like a lot of you can relate. So for a long time, my family member originally was like, "Oh, you're learning this. I would love to we could do some tests or, tell me what to do because I'd love to try some of this." And since I had opportunities to like get free testing and things when I was learning originally, I would sometimes use those for them and see it as practice. But what I learned was pretty quickly, like, that I still needed to stay in my lane as far as how I feel about caring for people that aren't my patient, and that as I tell students now all the time, a patient provider relationship needs to be established before you give anybody health advice because you never know what's going to happen and you should always be covered. And that certainly wasn't the case here. I just think that that is very important for all of us all the time. And I have certainly slipped up and not done that myself. But so that person was not ready yet and to do like true root cause approaches. So then I struggled with that challenge of like, okay, well, now I can see all these opportunities for them, but it's not me. I'm not in the driver's seat here, right? Like the patient is always in the driver's seat. It's not my decisions to make. I can provide information, but then it's your personal phone calls about health and health advice, or are they about, just family connection? And I think a lot of nurses struggle with that. Do people want me to go in a nurse mode, or do they want to just chat and get maybe some like empathy and a kind ear when they're struggling with something? And that gets really blurry for us too. So I feel like I've reeled that in well and had enough conversations with nurses to really explore that for myself. And where I landed with it and what I talk to nurses about now is that we can role model this. We can help patients with it that are ready. We can just set a good example, and that even if it's about like convincing other people that, family members, it's not going to happen, right? We can just set our best example, answer their questions if they have them, but otherwise, leave them to their own devices, have them see somebody else. If it's like another provider in your community or where you work, I've said this a lot, we can talk until we're blue in the face at trying to convince people that this works and that we can really help people in a different way. But I I haven't had a lot of students report back to me that they're successful. I haven't been successful. So I always say that the best way that we can validate what we do is to just focus on taking really good care of the people that are showing up and are ready to work on their health and let that be the example. And in the case of like an RN working with patients as a functional nurse, maybe it's just that those patients keep going back to that provider that you really wanted to convince, and they're better and they don't need all these medications anymore, and they're like all their lab work's looking better. That is the best thing that we can do to validate what we offer. So that's a little off topic, but I think it fit in here pretty well. So rather than trying to help people that aren't ready yet, focusing on people that are ready. So that's what I've been doing. And I've been having all these conversations with my students about it. And we've talked about like, what do you do when somebody in your personal life asks you for health advice and you don't feel like you're in a space to give them medical advice, like they're not your patient? And so I always use my ifm.org answer for everybody, help them find a provider or just direct them there to find a provider to work with. You're not their provider. And so my family member finally got to a place where they're like, I really want to do some work on my health and I want to see somebody that does kind of like you do, but I don't live near you. Who should I see? And for, the manyth time, I said, oh, you could use ifm.org to find a provider in your area. They ended up finding somebody that claimed to practice functional medicine, but not through that search feature. So maybe they used Google or something like that. And at some point in the search process, they asked me for my opinion. And I said, well, did you find them through the IFM search portal? No, but it says on their website that they have training through IFM. And then they told me at the first visit, I need this much money for all these supplements and all these tests. And I asked for more information about their training because you seemed curious. And they said that one of their pharmacists did one of IFM's courses, which, as we all know, IFM, or many of you probably know, IFM has like essentially 7 courses you have to take to get their certification. One of those is not particularly significant when we're talking about like whole person care. And now a quick word about our sponsor, the Institute for Functional Nursing. IFN is the leading education and community platform for nurses bringing functional medicine into their practice. IFN offers everything from short, on-demand contact hour courses to the full functional nursing program, designed specifically for nurses and nurse practitioners ready to practice root cause, whole person care. If you're looking for connection and real-time learning, the Functional Nursing membership includes 4 live meetings every month where we cover case studies and have open discussions and connection. Come be a part of a movement that's redefining what it means to be a nurse. Visit fxnursing.com to learn more and join us. And now back to today's episode. I haven't been asking a lot of questions about all this. My family member has been seeing them for a while. And recently they told me that their provider had done a test, or maybe they'd gotten the test online somewhere, I think they said, that indicated that they were deficient in a lot of nutrients. They went ahead and sold them a whole bunch of supplements to address this. And if you have already done training in functional medicine, you know that if somebody's deficient in a lot of nutrients, they are either don't have sufficient stomach acid, they are not consuming those nutrients, they are not absorbing those nutrients. Like there's something going on when it's a bunch of them. I always say, like, if it's vitamin D, maybe they need to get outside. Maybe there's like one thing that you need to address. Many of us are deficient in magnesium. It's just a reality of our food supply. Sometimes people might have that as one they're low in, and they could do a supplement for that. Very common. But if somebody has like a whole bunch of them deficient on one test, it's a pretty good indicator that some of the questions that I ask is like, first, for this person, because I know them, I was like, are you still on a proton pump inhibitor? Like, that's my number one thought because of my doctorate work. And I really care about that topic. So, no, they're no longer on a proton pump inhibitor. What is their diet like? Are they consuming all of these nutrients? But when it's all of them, it's gotta be a pretty bad diet for it to be, like, a ton of nutrients deficient. So, well, we have that, stomach acid, eating hygiene, um, are they in a resting and digesting mode when they're eating? But then even once it gets down, do they have the enzymes, like, everything there that they need to digest and break down their foods? And then beyond that, can it get into the body and where it needs to be? A lot of factors go into a nutrient deficiency, but when there are a bunch of them, it's it's a pretty big indicator that, there's more work to do. And there were some other things they told me about their health story that made me like pretty much 100% sure that they have enhanced intestinal permeability. And so I was like, "Oh, okay. Well, what do they have you doing for that?" And she starts naming off like bottle names for me. And it was a lot of them and they were very expensive. And then there was a recommendation for more testing. And so ultimately, I used my coaching skills. I just asked some open ended questions about it and how she felt about it. And interestingly enough, they went and did like just their own kind of exploration online and talked to ChatGPT about it a little bit. And funny enough, ChatGPT said, well, your sister knew who I was. So it's like, your sister would actually be able to answer this for you. And she would probably be pretty upset that this person treated you like that because that's not true root cause functional medicine. I'm not really laughing at it so much as they screenshotted it and sent that to me because they thought it was really funny. So, all that to say that this is happening all the time. Like every day, this is happening. And this is happening to patients in all of our communities. If there is a functional medicine provider in your community, it's happening to our patients, ourselves. A lot of my students have told me this has happened to them. I thought it'd be relatable to talk about it and have an episode where we explore it some, but also I don't know exactly what our role is in doing something about it. I've said for a long time that functional medicine has a branding problem, that like this idea of people buying a ton of really expensive supplements or being sent out the door with it is a really big problem. Patients should be spending that money on healthy foods or vacation or something, not, a ton of supplements, especially if they're just given to them long term without any plan for treating anything. Fortunately, in this case, my family member decided to, without me talking about it at all, decided to do an elimination diet and started feeling like way better and like has gone down a rabbit hole. So that's a really great outcome to that story. And luckily, that provider is helping them with some other things that they needed some relief for that is separate from functional medicine. And I think that's great. And I don't think that all of us need to practice functional medicine. I think people need all kinds of care, and they might do a really good job at those other things that they offer, but they're not doing a good job at functional medicine. Like, that's just my professional advice. Like, if you are seeing signs of deficient, tons of deficient nutrients on one test, enhanced intestinal permeability, and you have zero conversation about food or an elimination diet or healing the gut lining or digestion, absorption, like none of this is coming up, you're not practicing functional medicine. You're selling supplements to people. And like the person in my town that claims to do this, or in my area that claims to do this, has a really big display case up with a ton of supplements on it. And that is the primary focus, is like selling those. And when I have inherited those patients, they've just kind of substituted all their prescription medications for those really expensive supplements. And I don't know if that in itself is unethical, because I mean, is it worse than, giving out prescriptions all day without doing root cause approach? But I think saying or implying that you offer a root cause approach and 0% doing that, I think that's pretty unethical. So I think it's a really unfortunate place that we're at in that regard. The great things about it for us is it leaves a lot of room for us to step in and offer a true root cause approach. And that looks like exactly what functional nursing is like spending time with our patients, getting a really thorough history on them, developing a timeline and prioritizing their care, partnered with them, giving them some education around the topics that apply to them, and helping them to establish goals that align with their priorities and address the root cause of their health concerns, and really help them to get as close as possible to healing or prevention or improvement of symptoms for patients. And all of this is like tied to taking a really deep look at their health story over time, their diet, their lifestyle, stress and sleep, their environmental exposures, their genetics sometimes is going to play a role that we need to consider, especially if they're not making progress with the foundational things. And then referring people, we don't have to know everything or be everything to everybody. Knowing who to send them to, like using ifm.org, finding somebody that's qualified to care for them if it's outside your scope. But I think, identifying these types of providers and knowing if people that might be caring for your patients or in your community or that you might refer to can be helpful. So I would say, like, that whole idea, like my family member reaching out to them ahead of time and saying, "What does working with you look like?" And them saying, "It looks like $4,500 for the first getting started visit, and oh, we're going to do these tests for you, and you're going to buy this many supplements." That's not functional medicine, because how do you know what the root cause is for that person before you've ever met them? And how do you know what tests you need to order for them before you've ever met them? And so I think if they're seeing somebody that already knows exactly what they're going to do for them before they meet them, that's not functional medicine. We can encourage people to ask those types of questions. We can ask questions of the providers in our communities to find out and know if that's somebody we want to refer our patients to. If your patient is seeing somebody and you're curious, you could look at like their discharge summary or their after visit summary. If it isn't talking about stress or sleep or mindfulness or nutrition or any of those things, if they're not doing anything about their lifestyle and they left with supplements and they left with expensive tests to do, and they have no plan to address everything else going on in their life, that is not functional medicine. We can ask where people were trained. I think that that can be helpful. And of course, IFM has incredible training. Some programs claim to teach functional medicine and do it in a really brief window, or it's not terribly evidence based, or it's like designed for health coaches and not health professionals. So I think really looking at the care that they offer is the best indicator, and asking the providers questions like, how are they deciding which labs are necessary? How are they measuring progress for their patients? Because I think in this person's case, like in my family member's case, like, what were they using to measure their progress if they were just giving them a bunch of supplements all the time? Wherein, like, if we were working with somebody, we might use the MSQ and screen and see how they're doing with their symptoms, and then add in an intervention or two, have a follow-up visit. Maybe we do another MSQ. We can see progress. Our patients are telling us that their health goals are improving because we figured out what they want to work on and we're addressing the root cause. I'd say it's a red flag if they test everybody that comes through the door with all the exact same tests, because that's wasting people's money. I myself and hundreds of my students have made significant progress with patients without a bunch of expensive tests, sometimes using no lab work. often using just the lab work that existed before the first visit that are big indicators of things to work on for patients, often just using like their last few years CBC and CMP, and they'll often have like a lipid profile. Those things can be gold for things that are not optimized for people. I don't have a great answer for how to fix the problem. I think that the more that we focus on getting trained well and being credible sources for our patients and for people in our lives that come to us for advice, like our family and friends, we can give them specific guidance on how to vet a provider or encourage them to use ifm.org just to find a provider. If you're a nurse that's doing our program, maybe you find another nurse or nurse practitioner that is doing IFN's training and you have them work with them. You want to make sure that the care they're getting is really root cause medicine or root cause nursing and not some other form of care. I don't even know what the word for it is if they're just selling supplements. I bet one of my students is going to come up with a great name for that. So that's TBD. In closing, I feel like a lot of this is really relatable to many of you listening, be it your experience caring for your loved ones and wanting the best for them, your experience getting care for yourself in the functional space, or getting patients that have had this type of care and haven't gotten really great relief. I think one of the most unfortunate things is that people that are seeking that are typically looking to do the work, and instead they're, sold a bunch of supplements and get these tests, and they've spent a ton of money and didn't get results, and it can be really deflating and I think discouraging for them to work on their health moving forward. So I think that's really unfortunate. I think it is a big opportunity for us to step into these spaces and offer something different in our communities and educate the people around us. And you can be the person that creates awareness in your community, especially if you're like an entrepreneur and you're working on your presence on social media. You could do, some of your videos or things that you share or your blogs could be about like, am I really working with a functional medicine provider? And you could kind of write about these themes too. So getting this information out there to more people and us really having real conversations with people about it, clarifying what the functional approach really looks like and what it doesn't look like. I think that's the best we can do that I can think of right now, but I am talking with nursing professionals all the time about this, so I have a feeling it's going to come up more in the coming weeks for me, and maybe I'll have some more thoughts. And I hope that you benefited from this. And until next time, be well. Thank you for tuning in to the Functional Nurse Podcast. If today's episode resonated with you, be sure to subscribe and leave a review. It helps other nurses find this movement. To learn more about our programs and join the community at IFN, visit fxnursing.com. Together, we're not just rethinking healthcare, we are rebuilding it from the inside out.